Hello, in this video, I wanted to talk to you about why we work with kids. And we love working with kids for the idea of preventing a lot of problems down the road, and the idea of wellness, helping that child develop to be as healthy as they possibly can, at least from our side, working with the spine, with the nervous system. And to help you understand that, I want to actually tell you a little bit of the history of orthopedics. When you look at orthopedics, ortho stands for straight. So when you think of an orthodontist, they're working to straighten all of your teeth. So when you hear ortho, just think of straight. When you hear pedics, that's pediatrics, or kids or children. So what they realized in the 1700s, when that whole profession really started, was they realized that if they can do everything they can to help a child straighten out either their limbs or their spine and their body, that the child is going to develop much healthier and have a better quality of life throughout their life. The reason is that if they have deformities, if their spine is shifted off, then that can potentially cause problems down the road. So they developed surgeries, they developed braces for these kids to wear at an early age to help realign everything in their body, their spine, their arms, their legs, everything, to help get it all realigned in that nice straight alignment that we know our joints should have, so they have a better quality of life throughout their life. Now, what's interesting with chiropractic is one thing we look at with kids is we look at posture. We want to make sure that the posture is symmetrical. So when you look front to back of someone's spine, the spine should be straight up and down. That's ideal. When you look at the side of the spine, there is actually supposed to be curves in the spine. So when we look at posture, we want to make sure that the shoulders are level, the head's level, it's not tilted to the side, the shoulder's not tilted, they don't have a high hip, or their ribs aren't protruding on one side. We want to make sure that all of those things are level. And we also want to make sure, when we evaluate a child, we want to make sure that their range of motion is symmetrical from side to side. One thing that's common for children, and this is a lot of times due to the birth process, is that they might favor one side. With infants, they might actually favor one side and they can't turn all the way. And so that's a sign that there's something in their spine, in their body, and maybe in their muscle or soft tissues that's locked up and restricted, and it's not allowing them the full range of motion to come all the way to the other side. So there's another saying that as the twig is bent, so grows the tree. So if you take a small twig or a sapling that's growing and you bend that over, as it continues to grow and develop, it's going to continue to grow and develop in that deformity. So with children, if they have asymmetrical postures where their posture's shifted off or their range of motion's locked up to one side and it doesn't ever get corrected, then down the road, as the twig is bent, so grows the tree. Down the road, they can actually start to develop degenerative arthritis at an earlier age because their joints aren't functioning properly. And so with children, it's so easy to adjust kids, and to be honest, they don't need as much care as most adults need, because they haven't had problems sit in their spine for years and years and years, causing massive amount of bone spurs and arthritis and degeneration. But for kids, it's usually a pretty quick response that you can balance everything back out. You can help the shoulders become more symmetrical, the spine become more symmetrical, so they develop and they have a better quality of life, just like the orthopedics we're seeing in the 1700s, just like they do a lot of times nowadays, except of course they use braces and they can use surgery, whereas we use adjustments, we use exercises and things like that. I'll give you one last example, and it really comes from both of my kids. My son, now this year is in 2015, my son is 5.5 years old, and he had a very long labor, and his head was stuck during labor. His head is tilted to the side. And so imagine this. Imagine you're that infant with your head tilted to the side, and a strong uterine muscle is trying to push you out the birth canal. When he came out of the birth canal, his head, he would lean to the side. And so it took almost a month for us to completely balance that completely out, where he doesn't have any alignment issues or problems in his neck. But our daughter, on the other hand, her birth was actually a lot faster and a lot smoother, didn't have the problems with her alignment. She didn't have any problems at all when she came out of the womb, when she came out of the birth canal. So it can be totally different for kids. And in the earliest age we've ever checked a child was after 1 day after birth. And we've done that for patients. We've done that, of course, we've done that for our kids. But it's just making sure that everything's aligned properly. So their spine, their nervous system, their joints, and their body is developing the best, the healthiest way possible. So I hope that helps you understand a little bit more about why we adjust kids, why we check kids, why we evaluate them. Because if you can take care of things when they're young, that can help them prevent a lot of serious problems down the road. If you have any other questions, of course, you can call our office. You can ask questions on Facebook. You can email us, whatever you would prefer. But I hope that helps you understand why we do that, and hopefully we can see your kids at some day soon. Have a good day.